Hey guys, welcome to Medifaction. Today we're going to discuss about the topic the lungs. So we all know that the lungs are specialized organs meant for breathing. So how about we know more about it rather than just a breathing organ? So let's begin. So in this video, I'm going to enumerate about the introduction of lungs, the features which comprises, shape, surfaces, coverings and borders of the lungs, the fissures and lobes present on the lungs, and the root of the lungs with the arrangement of structures, relations and its contents. We're also going to discuss about the difference between right and left lung along with the blood supply which has the arterial supply and venous drainage. And finally, we are going to discuss about the lymphatic drainage and the nerve supply as well. So let's begin. Introduction. The lungs occupying major portions of the thoracic cavity leave little space for the heart, which excavates more of the left lung. The two lungs hold the heart tight between them, providing protection. There are 10 bronchopulmonary segments in each lung. The lungs are a pair of respiratory organs situated in the thoracic cavity. Each lung invaginates the corresponding pleural cavity. The right and left lungs are separated by the mediastinum. The lungs are spongy in texture. In the young, the lungs are brown or grey in color. The right lung weighs about 700 grams. It is about 50 to 100 grams heavier than the left lung. Coming to the features. Each lung is conical in shape. It has an apex at the upper end, right here you can see, and a base which is resting on the diaphragm. There are three borders which are the anterior border, the posterior border and inferior border. And there are two surfaces. One is the costal surface and other is the medial surface. The medial surface is divided into vertebral and mediastinal parts, that is anterior and posterior respectively. The apex is blunt and lies above the level of the anterior end of the first rib here, and it reaches nearly 2.5 cm above the medial one-third of the clavicle, just medial to the supraclavicular fossa. It is covered by the cervical pleura and by the suprapleural membrane and is grooved by the subclavian artery on the medial side and anteriorly. The base is semilunar and concave. It rests on the diaphragm, which separates the right lung from the right lobe of the liver and the left lung from the left lobe of the liver, the fundus of the stomach and the spleen, which comes here approximately. The anterior border, as you can see here, is very thin. It is shorter than the posterior border. On the right side, it is vertical and corresponds to the anterior or costo-mediastinal line of pleural reflection. The anterior border of the left lung shows wide cardiac notch below. This is the left lung, and here you can see a wide cardiac notch below the level of the fourth costal cartilage. The heart and pericardium are not covered by the lung in the region of this notch. The posterior border is thick, as you can see here. The posterior border is thick and it is ill-defined. It corresponds to the medial margin of the heads of the ribs. It extends from the level of the 7th cervical spine to the 10th thoracic spine. The inferior border separates the base from the costal and medial surfaces. The costal surface is large and convex. It is in contact with the costal pleura and the overlying thoracic wall. The medial surface is divided into posterior or vertebral part and the anterior or mediastinal part. The vertebral part is related to the vertebral bodies, intervertebral discs, the posterior intercostal vessels, and splanchnic nerves. The mediastinal part is related to mediastinal septum and shows a cardiac impression on the hilum. Here you can see the cardiac impression. and a number of other impressions which differ on the two sides. Now let's move on to the fissures and lobe of the lungs. The right lung is divided into three lobes: the upper, the middle, and the lower lobe by two fissures, a horizontal fissure and an oblique fissure. The left lung is divided into two lobes with the presence of an oblique fissure. Right here you can see. The oblique fissure cuts into the whole thickness of the lung except at the hilum. It passes obliquely downwards and forwards, crossing the posterior border. Due to the oblique plane of the fissure, the lower lobe is more posterior and the upper and middle lobe more anterior. In the right lung, the horizontal fissure passes from the anterior border to the oblique fissure and separates the wedge-shaped middle lobe from the upper lobe. Here you can see this is the horizontal fissure separating it from the middle lobe and upper lobe. The fissure runs horizontally at the level of the fourth costal cartilage and meets the oblique fissure in the mid-axillary line. This is the mid-axillary line. The tongue-shaped projection of the left lung below the cardiac notch. This is the cardiac notch here, and this is the tongue-shaped projection. This is called lingula. It corresponds to the middle lobe of the right lung. You can see the right lung and it corresponds to it. The lungs expand maximally in the inferior direction because the movement of the thoracic wall and the diaphragm are maximal towards the base of the lung. The presence of the oblique fissure on each lung allows more uniform expansion of the whole thing. Root of the lung. Root of the lung is a short, broad pedicle which connects the medial surface of the lung to the mediastinum. It is formed by structures which either enter or come out of the lung at the hilum. The roots of the lung lie opposite the bodies of the 5th, 6th, and 7th thoracic vertebrae. Contents. The root is made up of the following structures. Number 1, principal bronchus on the left side and eparterial and hyparterial bronchi on the right side. 1 pulmonary artery, 2 pulmonary veins, that is superior and inferior. Bronchial arteries, 1 on the right side and 2 on the left side. Bronchial veins, anterior and posterior pulmonary plexus of nerves. Here you can see that. Lymphatics of the lung, bronchopulmonary lymph nodes, and areolar tissue. Arrangement of structures on root. From anterior to posterior, it is similar on both the sides. There is superior pulmonary vein. You can see the superior pulmonary vein here. Then you can see the pulmonary artery just near to it, and there is bronchus. From above to downwards, it's different on the two sides. On the right side, there is eparterial bronchus here, pulmonary artery here, hyparterial bronchus right here, and for the left side, there is only pulmonary artery, bronchus, and inferior pulmonary vein. Relations of root. On anterior aspect, it is common on the both sides. That is, there is phrenic nerve, pericardiacophrenic vessels, anterior pulmonary plexus. On the right side, there is superior vena cava, a part of the right atrium. On posterior aspect, the common to the two sides are the vagus nerve and the posterior pulmonary plexus. On the left side, we can observe the descending thoracic aorta. Superiorly, on the right side, the terminal part of the azygous vein can be observed, and on the left side, there will be the arch of aorta. Inferiorly, there will be pulmonary ligament. The difference between right lung and left lung. The right lung consists of 3 lobes, whereas the left lung consists of only 2 lobes. Right lung consists of 2 bronchi and left lung consists of only a single bronchus. Right lung is heavier, left lung is lighter. Right lung is shorter and wider. Left lung is longer and narrower. Right lung provides space for the liver, whereas the left lung provides space for the heart. Moving on to the blood supply. In arterial supply, the bronchial arteries supply nutrition to the bronchial tree and to the pulmonary tissue. On the right side, there is one bronchial artery which arises from the third right posterior intercostal artery. On the left side, there are two bronchial arteries, both of which arise from the descending thoracic aorta, the upper opposite fifth thoracic vertebra, and the lower just below the left bronchus. Deoxygenated blood is brought to the lungs by two pulmonary arteries here, and oxygenated blood is returned to the heart by the four pulmonary veins. There are precapillary anastomosis between bronchial and pulmonary arteries. These connections enlarge when any one of them is obstructed in disease. For venous drainage, the venous blood from the first and second division of the bronchi is carried by bronchial veins. Usually, there are two bronchial veins on each side. The right bronchial vein drains into the azygous vein. The left bronchial vein drains into the hemiazygous vein. The greater part of the venous blood from the lungs is drained by the pulmonary vein. So here you can observe this is the right lung, and you can see the superior vena cava passing, and this is the right pulmonary veins. This is the inferior vena cava right after it passes the ventricle, and this is the aortic arch. This is the left lung, and this is the left pulmonary arteries, and here you can zoomed in with the pulmonary capillaries. This is the descending aorta. That's all. Now coming to the lymphatic drainage, there are two sets of lymphatics. Superficial vessels drain to the peripheral lung tissue lying beneath the pulmonary pleura. The vessels pass around the borders of the lung and margins of the fissures to reach the hilum. Deep lymphatic drains the bronchial tree, the pulmonary vessels, and the connective tissue septa. They run towards the hilum where they drain into the bronchopulmonary nodes. The nerve supply. For the parasympathetic nerve supply, which is derived from the vagus, there are certain fibers. A. Motor to the bronchial muscles and on stimulation cause bronchospasm. Secretomotor to the mucous glands of the bronchial tree. Sensory fibers are responsible for the stretch reflex of the lungs and for the cuff reflex. Sympathetic nerves. These are derived from the second to the fifth sympathetic ganglia. These are inhibitory to the smooth muscle and glands of the bronchial tree. Hope you have understood the video. Like, subscribe, and press the bell button for more videos. Thank you. Thanks for watching.